I hear patients say all the time, why do my eyes look so tired? And even after a full night of sleep, you're not alone. A big part of this comes from something most people don't realize. It's mid-face hollowing that's associated with eyelid aging. And today I'll show you how I address it with fat grafting, usually in combination of a lower lid blepharoplasty with fat repositioning, and how that in combination has been a game changer for my patients.
Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
As we age, two big things usually happen around the eyes. First, the fat pockets, the fat pads under the lower eyelids bulge forward, creating puffiness or bags. Second, this volume loss in the midface and under eye area creates shadows, hollows, and that constant tired look that my patients complain about. If I only perform a lower lid blepharoplasty and just remove skin and just remove fat, well, certainly it can improve the puffiness, but that does not address the hollowing. That's where fat repositioning helps in improving the hollowing in the under eye area. But that's not just it. If we restore volume to the surrounding periorbital areas, then there may be a loss of that sort of lid-cheek junction that's supposed to be nice and smooth. So fat repositioning with a blepharoplasty is a beautiful procedure, but it has its limitations in those patients that also have volume loss in the surrounding midface area. And that's where fat grafting with a blepharoplasty is a beautiful touch to achieving that rejuvenation that those patients need. Lower lid blepharoplasty is excellent for removing excess fat and hollowing in the under eye area and also improving skin texture with either a CO2 laser, chemical peel, microneedling, or essentially removing skin through a skin pinch if there's excess skin in that particular patient. But here's the key. My technique is the natural looking blepharoplasty that I've developed and trademarked is designed to avoid the overdone or hollow look that's all too common. The goal isn't just to take away, it's to preserve, it's to reposition and enhance what's already there so you still look natural. Now let's talk about fat grafting. Fat grafting is where I carefully transfer a patient's own fat into the areas of volume loss around the periorbital area, such as the midface or the cheeks, and if need be in the under eye area to the area that's have lost volume with aging. Think of it like refilling a cushion that's gone flat. It brings back softness, smooth transitions, and that youthful contour. Unlike fillers, which are temporary and may cause potential issues of swelling, maybe even migration, fat grafting integrates with the tissue and provides long-lasting natural results. It is essentially your own natural filler. When done precisely, it doesn't look puffy. It looks like you just refreshed. So why combine the two? Because addressing only one problem isn't enough. If I just remove fat, if I just remove skin, well, the hollows remain. But if I add volume through fat repositioning, but then also really enhancing that with fat grafting around other areas of volume loss, such as the midface or cheeks, now I'm combining blepharoplasty to treat the puffiness, to treat the excess tissue with fat grafting to restore youthful volume. It creates harmony. The lower eyelid and midface blend seamlessly. This combination is what truly makes patients look rested, youthful, and natural. So who is this right for? You may be a candidate if you have hollowing under the eyes or deep tear troughs, notice bags or puffiness in the lower eyelids, feel like fillers are no longer giving you the results you want, or you're having issues with injectable fillers done in the past, or simply feel that your eyes make you look tired even when you're not. Remember, every patient is different, which is why I customize the procedure to fit your anatomy and goals. I recently had a patient who came in saying people keep asking if I'm stressed or not sleeping enough. In her particular case, we combined fat grafting with a lower lid blepharoplasty and fat repositioning. After recovery, she told me, finally look the way I feel, rested and confident. That's the power of addressing both the puffiness and the hollowing together. When performed thoughtfully, fat grafting plus lower lid blepharoplasty with fat repositioning is a game changer. It doesn't just make you look less tired, it restores balance and harmony so you look like yourself, just only more refreshed. If you found this helpful, hit subscribe and share this video with someone who's been thinking about under eye rejuvenation. And if you're ready to explore your options, I'd love to see you in for a consultation.